We believe that 1,749 people in South Africa now have tested positive, and sadly 13 people have died, with one new death that's been reported, a man who had stage 4 prostate cancer at Parklands Hospital. We'll have more on that a little bit later on. All right, let's carry on now, and I'm going to bring you a story. Many of you will have probably heard of the AU non-governmental agency, NEPAD, well, it's launching a COVID-19 response plan on April, regarding the coronavirus pandemic, which is currently putting people at risk, as you would imagine. So I'm going to speak now to somebody from NEPAD to give us an indication of what this response plan is going to be about. Let's cross now to Estherine Fotabong. Thanks so much indeed for joining us, and welcome to the program.
Thank you for having us, Peter.
All right, let's begin with this NEPAD response plan. A lot of people wouldn't associate NEPAD with fighting pandemics. You know, we've kind of sort of associated you with other issues, and I just wonder, give us a bit of background as to how NEPAD decided to come with a response plan.
Thank you so much, Peter, for having us. As you will know, the African Union Development Agency, NEPAD, is the development arm of the African Union. That said, we have a wide range of subjects that we cover as a result of our mandate, including, of course, issues of health. And as you know, the coronavirus outbreak should be looked from a multidimensional lens, because even though it's an health epidemic, it has a wide range of impacts in our society, in our economy. So it affects economies, it affects the social life of our people, as well as perhaps could have political consequences. So being the Continental Development Agency, it is just important that we have a response plan to this pandemic.
All right, so take us through some of the issues that you're having to balance when you come up with a response plan, because on the one hand, lockdowns have to happen, and then on the other, there's this issue of the country's economies, and they somehow need to find a way to keep going. So talk to us about some of the dilemmas the continent is facing in coming towards a response plan.
Well, of course, the overall objective of the response plan is really to support member states to ensure the least economic, social, and political disruptions from the outbreak. It brings to bear the critical need for regional cooperation and integrated support systems at the continental level. As you will know, since the outbreak of this virus, our member states have had to respond in a situation to which no one was expecting. And therefore, there is a challenge in terms of delivering some of the equipment that member states need to not only test the virus, the population, to see who has it, but also to respond to the findings of such tests. Also, the measures to try and contain the spread of this virus, some of the challenges that the member states do have. Challenges of just getting data, the information of where you have the patients and how to track them. These are issues that we need to member states need to attain with. Issues of lockdowns, as you know, our member states have responded quite swiftly to restrict movements, not only within the countries, but also a movement coming into the countries. As of course, that has had impact of people have to stay at home to observe the social distances, and that have consequences in terms of jobs, incomes, and so on and so forth. So these are critical issues that member states are facing, to which the NEPAD AUDA response plan is attempting to address, to help bring some solutions to the member states.
You are exploring with this response, and I'm not going to go them in order, but one that stands out for me, food and nutrition security. That must be quite an important one, particularly during this time.
Absolutely. The action plan has 7 priority areas: the health system, the food and nutrition system, skills development and employment, education, tourism, and national planning and data system. You just mentioned the food systems. Of course, the world we live in today, is based on supply chains. We live in a globalized world that, things are not only produced in a country. We have a global market. The supply chains can come from everywhere. Now, with the situation of the coronavirus, we might find a serious challenge in terms of, things that we are expecting to come. Some of the food items that we expect to come, what we import from other countries, might not be available for our countries and our populations. So it is critical, as we look at and we learn from this virus, to prioritize regional value chains, bring capacity within our countries and our regions to be able to produce what we need, from the farm to the table. I think we have an opportunity with the Continental Free Trade Area to make sure that we do explore the possibility of developing those value chains within the continent, and making sure that we can, of course, we will try as much to promote that self-sufficiency in the continent by encouraging investments in industries, in manufacturing, in ensuring that our productive capacity is enhanced, and ensuring that our own local private sector becomes active player in ensuring that we have food security in the continent.
All right, you talked about manufacturing, but it's not just in food, I guess. Also important, research, development, innovation, local manufacturing. It also speaks to medicines, doesn't it? Because for years and years, we've been very dependent on importing medicines. And perhaps for us to prepare ourselves for these pandemics, we need to have our own pharmaceutical companies growing in their numbers on the continent.
Absolutely. And NEPAD has been working on this for a number of years now. I think the coronavirus outbreak just brings to bear the importance of ensuring that we do have our own manufacturing plants in the continent. We do have standards that are shared amongst member states of the continent, so that we can then go into production. We can then look at economics of scale. We can then look at comparative advantages of different countries in terms of how we manufacture not only medicines, but also the distributions of this medication, and following a common standard so that it's acceptable. So the African Medicine Regulatory Plan is actually aimed at doing this, encouraging the manufacturing of medicines in our own countries. I think this outbreak will only bring a lot of impetus to drive the quick development of industrialization in our member states, with a very strong focus on the manufacturing of drugs. Now, not only that, will also entail that we look at our educational system. Are we training enough young people to go into innovation, to go into to become chemists, to go into drug development? I think all of this actually gives us room to think and recast the emphasis that we have given so far into some of these critical sectors. The NEPAD response plan is not just for the period where we fight this virus, but it's a 3-year plan. So it goes beyond the emergency responses to put in place these actions that are sustainable, that will look at these sectors, whether it's education, the food systems, the manufacturing aspect. So we protect ourselves for future epidemics and pandemics such as this.
All right. So unfortunately, we've run out of time, but it'd be nice to talk to you again in the near future just to see how things are developing, because I would imagine this is the kind of thing that governments and the private sector need to work together. So thanks so much indeed for this initial conversation. We'll catch up with you again in the near future.